Welcome back all of you to the mock test answer explanation videos. Next question. Iron deficiency anemia is an example of option A, macrocytic anemia, option B, normocytic anemia, option C, microcytic anemia, option D, hemolytic anemia. Let us go to the answer. The right answer here is option C, microcytic anemia. Let us see the different types of anemia, types and examples and characteristics. First one is normocytic, cells normal size. This is due to the hemorrhage anemias and all. Microcytic anemia, cells bigger than normal. Megaloblastic and pernicious are the example. Microcytic, cells smaller than normal. So macro bigger, micro smaller. This is iron deficiency anemia. Hypochromic, cells paler, yellow color than normal or pale than normal. That is iron deficiency anemia again. So iron deficiency is basically microcytic and hypochromic. Then hemolytic anemia is sickle cell anemia, that kind of autoimmune disease. Hypoplastic and aplastic is the bone marrow function deficiencies. Hypoplastic reduced bone marrow function and aplastic upset bone marrow function. The memory tip here is just to remember this word: macro mega pernicious, micro hypochromic iron deficiency anemia, iron, auto sickle hemolytic, aplastic bone marrow. Next question. Tricuspid valve is situated between option A, left atrium and left ventricle, option B, right atrium and right ventricle, option C, left ventricle and aorta, option D, right ventricle and pulmonary artery. The right answer here is option B, right atrium and right ventricle. Let us see the valve here. Valves and position. Mitral valve is bicuspid valve. It is between left atrium and left ventricle. Tricuspid valve is between right atrium and right ventricle. Aortic valve is between left ventricle and aorta. Pulmonic valve is between right ventricle and pulmonary artery. Let us see the memory tip here and the diagram for anatomy here. Tricuspid right, mitral by left. So mitral is bicuspid, that is left. Tricuspid is right. See here the tricuspid in right and mitral in left. The color code also you can see the blue color coding also given to memorize and connect it. Next question. An adult in old age will go through which of the below psychosocial stages? Option A, trust versus mistrust. Option B, industry versus inferiority. Option C, identity versus role confusion. Option D, integrity versus despair. The right answer here is option D, integrity versus despair. Let us see the psychosocial development stages according to the ages. Infant, trust versus mistrust. Toddler, autonomy versus shame and doubt. Preschooler, initiative versus guilt. Grade schooler, industry versus inferiority. You can see the age also in between. It is given in the bracket. Teenager, identity versus all confusion. Young adult, intimacy versus isolation. Middle adult, generosity versus stagnation. And old adult, integrity versus despair. We can have a memory tip or memory trick with diagram here. This is a memory trick actually. You will try to follow these words. Infant need trust. Toddler need autonomy. Preschooler has initiative. School is industry. So these words will have the clues, and when you are going for an objective type or multiple choice question, you will connect with this word and you will easily identify the right option. Infant need trust. Toddler need autonomy. Preschooler has initiative. School is industry. Teenager is having confusion. See. Young adult, intimacy. Middle adult, generosity. Old age, skin integrity issues. Skin will be very fragile. So old age, integrity versus despair is the right answer. Next question. What is the normal length of the neonate body? Option A 52 centimeter. Option B 50 centimeter. Option C 49 centimeter. Option D 55 centimeter. The right answer here is option B 50 centimeter. The normal length of neonate body is normally 50 centimeter. Next, a pattern in which the nursing personnel divide the patient into groups and complete their care together is called option A primary method, option B team nursing, option C nursing managed case method, option D case method. The right answer here is option B team nursing. You can see the different nursing methods. Case method assigning one nurse to provide total care to one patient during their shift, that is case to case method. Primary and team nursing. In primary nursing, single nurse maintains the patient care, but in team nursing model, different tasks of the patient care are given to different people like nursing aides, then technicians, etc. according to their scope of practice. So this is team nursing. So the right answer is team nursing. Next question. Which among the following is a type of non-probability sampling? Option A systematic sampling. Option B stratified random sampling. Option C purposive sampling. Option D multi-stage cluster sampling. The right option here is purposive sampling. Here you can see the probability and non-probability sampling methods. Non-probability is convenient sampling, quota sampling, snowball sampling, and purposive sampling or judgmental sampling. Probability samplings are simple random sampling, stratified sampling, systematic sampling, and cluster sampling. The memory tip here is probability, simple, stratified, systematic, cluster. Non-probability, purposive, quota, convenient, snowball. Next question. What is the characteristic feature of biliary colic? Option A. Mid-epigastric pain that radiates to back. Option B. Upper right abdominal pain that radiates to the back or right shoulder. Option C. Localized lower right abdominal pain. Option D. Localized pain in the hypogastric region. The right answer here is upper right abdominal pain that radiates to the back or right shoulder. Biliary colic, you can see the diagram. It has pain in the middle to right upper abdomen. You can see the right area, middle to right abdomen, and pain can radiate to the shoulder as well. Pain feel like sharp, crampy or dull ache. Next question. What is the technique used to demonstrate the relationship between the intravesical pressure and the volume of urine in the bladder? Option A cystoscopy, option B cystometry, option C pyelogram, option D ureteroscopy. The right answer here is option B cystometry. Here you can see different terms associated with this question. Cystometry is the test used to look for problems with the filling and emptying of the bladder. So that is cystometry. It is a measurement. Cystoscopy is visualization. Metry is measurement and cystoscopy is visualization. Cystoscopy is the visualization of urine bladder and urethra. Pyelogram is imaging of renal, pelvis and ureter. Ureteroscopy is the examination of the upper urinary tract including ureter with a ureteroscope. Next question. Channeling of a strong and socially unacceptable drive or urge to a form that is acceptable to society is called option A repression, option B sublimation, option C regression, option D denial. The right answer here is option B sublimation. Let us go through these defense mechanisms. Regression. in this mechanism, people seems to return to the earlier development stages like embryo or the infant or the toddler or schooler, something like that. Repression, it is the defense involve blocking or withholding unpleasant thoughts or feeling from the conscious awareness. So they don't want to remember some unpleasant experiences in the past, so it will be repressed. Sublimation is the one in which that unacceptable impulses are transformed into socially acceptable behaviors. So this is the right answer here. Denial, of course, that is a defense mechanism where someone refuses to acknowledge painful fact or realities. So here, the memory tip is regression. Early development stage example is thumb sucking. That is in the infant or toddler stages. So this is one of the example. Then repression, unconsciousness, blocking of unpleasant emotions. For example, child abuse. If someone is already experienced child abuse in their childhood, that they don't want to remember and they will repress it. Sublimation we already seen. Unacceptable to acceptable behavior, that is anger to sports. If some person is emotionally short-tempered, then they will transfer that energy to sports or martial arts. Denial, it is not accepting the reality. For example, a person diagnosed with cancer, diagnostics, that they will deny the disease first. Next question. A patient comes to trauma care and receives fluid bolus. Next advice is to maintain air fluid NS at 30 ml per hour. The nurse connect macro drips at 15 drops per ml. How many drops per minute the IV fluid should be infused to meet the maintenance rate? Option A, 30 drops per minute. Option B, 15 drops per minute. Option C, 7.5 drops per minute. And option D, 12.5 drops per minute. If you need here the additional time, please pause the screen and do the calculation and go to the right answer. Let me discuss the right answer here. The right answer is 7.5 drops per minute. Here you can see the calculation. The required rate is 30 ml per hour. We need to convert to drop per minute. This ml per hour should be transformed to drop per minute. 30 ml per hour is 30 into 15. That is the drops in divided by 60. 60 is the hour. Hour to minute conversion is the 60. So 30 into 15 by 60 is 1 by 4. So 30 by 4 is 7.5. Here the memory tip or for the easy flow rate calculation is, if you are using a macro drip set, you divide this by 4 or multiply by 1 by 4. For micro drip set, ml per hour and drop per minute will be the same. So here, this is because the macro drip set will be always having 1 ml is equal to 15 or 16 drops. That will be approximately 1 by 4. Then micro drip set will be having 1 ml is equal to 60 or 64 drops. That will be approximately, the drop value will be 1, because the 60 is the constant factor, because that is the hour to minute conversion. Next question. While the nurse plan care for a patient with pneumonia, which of the following nursing diagnosis require highest priority? Altered sleeping pattern. Option B, risk for impaired skin integrity. Option C, ineffective coughing. Option D, ineffective breathing pattern. The right answer here is ineffective breathing pattern. Option D. Here this is the kind of application level question with priorities and guidelines. Here you clearly see the ABC protocol. So airway, breathing, circulation. Sleeping is not a priority, not coming in ABC. Skin integrity also not coming in life-threatening or ABC. Coughing is also not such a life-threatening condition. So breathing pattern is contributing to the life-threatening situation, so that should be addressed in priority basis. Next question. What is pulse deficit? A difference, option A, difference between the brachial and ankle pulse rate. Option B, difference between the radial and ankle pulse rate. Option C, the difference between apical and radial pulse rate. Option D, the difference between popliteal and ankle pulse rate. The right answer here is option C, difference between apical and radial pulse rate. The pulse deficit is difference between apical and peripheral pulses. So it can be a signal for arrhythmias like atrial fibrillation and all. Next question. The proportion of clinical cases resulting in severe clinical manifestations is known as option A, infectivity, option B, virulence, option C, pathogenicity, and option D, pre-pathogenesis. The right answer here is option B, virulence. Virulence is the ability of a microorganism to cause damage to its host. So it is related to the extent of damage, quantitative. But pathogenicity and infectivity is qualitative, which is the ability of a microorganism to cause disease. Infectivity is the similar term, ability of a microorganism to cause infection. But here, virulence is the ability to cause damage. Next question. A patient on O2 via TPs. The current O2 is on flow at 3 ml per minute and the SpO2 is showing 89% and PCO2 is in normal range till now, but gurgling sound present. What is the most appropriate action among the below? Option A, decrease the O2 1 liter per minute and monitor SpO2. Option B, suctioning, continue O2 and monitor SpO2. Option C, inform the nursing supervisor. Option D, continue the SpO2 monitoring and call the doctor. This is an application level question. Read it carefully, apply all the guidelines, protocols and answer it. The right answer here is option B, suctioning, continue O2 and monitor SpO2. Here it is, I told you ABC protocols. Here the airway is compromised because of the secretions. Most probably that may be the reason for obstructing airway and desaturating. So try to clear the airway by suction. Then if it is not solved, then the other steps will come like SpO2 monitoring, continuing and calling the doctor, doing some other advanced intervention. But always go to the priority and basic thing first. Decrease the O2 is the opposite. This is for the elimination. This is all the technique for doing application level question. Inform the nursing supervisor is not very significant here. Next question. Enterotoxin food poisoning is mainly caused by option A, streptococci, option B, salmonella, option C, staphylococcus, option C, pseudomonas. The right answer here is option C, staphylococcus. Staphylococcal food poisoning is an acute intoxication that occurs when food contaminated with enterotoxin produced by the bacterium, by this bacterium consumed. So when Staphylococcus bacteria is consuming the food, they will release this enterotoxin and it will cause the food poison. So this is the right answer is staphylococcal. Next question. A patient in heart failure has a drug dose of Dobutamine 5 microgram per kg per minute, dilution of 250 milligram of Dobutamine done in 50 ml diluent. Patient's weight is 60 kg. How many ml per hour of the solution should be set in a syringe pump to increase the prescribed dose? Option A, 5.4 ml per hour. Option B, 3.6 ml per hour. Option C, 2.7 ml per hour. Option D, 1.8 ml per hour. Here also again, if you need the additional time, you pause the screen and do the calculation and fix your answer and go to the right answer. The right answer here is option B, 3.6 ml per hour. Let us see the calculation. Required dose is 5 microgram per kg per minute. Weight is 60 kg. Dobutamine dilution is 250 mg in 50 ml. So 250 mg and 50 ml means it will be converted to microgram. So 1 mg is 1000 microgram. So 250 into 1000, 250,000 microgram in 50 ml. So 1 ml contain 250,000 divided by 50 is equal to 5,000 microgram per ml. So each ml will be having 5,000 microgram. But how many ml we need in as per this rate in an hour is, we will calculate like 5 microgram per kg per minute. That is 5 into kg is 60 and minute to hour it is 60. So 60 minute is 1 hour. So this will be multiplied. So total this batch microgram per hour should go. So this is 5 into 60 into 60 is 18,000 microgram should go. So 1 ml is having 5,000 microgram. So to obtain 18,000 microgram, 18,000 divided by 500, that is 3.6 ml per hour should go. Next question. Which is the plasma protein that constitute about 40 to 60% of total plasma protein? Option A, fibrinogen. Option B, globulin. Option C, albumin. Option D, fibrin. The right answer here is option C, albumin. You can see the diagram and the chart here. Albumin is consisting of 50 to 60%, globulin is 30 to 40%, and fibrinogen is less 7%. You see here, albumin 55, globulin 38, and fibrinogen 7. And this is the top portion is plasma, and here is the blood corpuscles or blood cells. Next question. Choanal atresia and recognition. Next question is, choanal atresia is the condition in which option A, congenital obstruction of the nasopharynx. Option B, congenital obstruction of the anal sphincter. Option C, congenital obstruction of the urethra. Option D, congenital obstruction of the oropharynx. The right answer here is congenital obstruction of the nasopharynx. You can see here, choanal atresia is a congenital narrowing of the back of the nasal cavity that causes difficulty in breathing. You can see the diagram also here to memorize it. Next question. The primary granuloma formed in tuberculosis is known as option A, gaseous focus. Option B, Cohn's focus. Option C, goblet cells. Option D, Reid cells. The right answer here is Cohn's focus. A Cohn's focus is a primary lesion, usually subpleural, often in the mid to lower zone, caused by Mycobacterium bacilli. Gaseous necrosis is a type of cell death seen in tuberculosis with cheese-like appearance. You can see the diagram here. Goblet cells, you know, it is already in intestinal mucosa of epithelial cells. Next question. A patient with type 1 diabetes mellitus is undergoing surgical amputation of diabetic foot. This is an example of which type of surgical intervention? Option A, constructive. Option B, curative. Option C, palliative. Option D, diagnostic. The right answer here is option C, palliative. Palliative surgeries example is diabetic foot for amputation. So this is just to support the patient to alleviate symptoms. It will not cure, it will not diagnose, it will not do any reconstruction. So this is palliative. Diabetic foot amputation is one example. Diagnostic surgery is to find the cause of the disease or diagnose the disease. So this is example is breast lump biopsy. Reconstructive surgery example is cleft lip and palate repair. Cleft lip and cleft palate repair is the example for reconstructive surgery. Curative surgery, for example, removal of thyroid gland for thyroid cancer is a curative surgery, so that the cancer will be removed. Next question. Which vitamin is essential to convert prothrombin to thrombin? Option A, vitamin D. Option B, vitamin A. Option C, vitamin K. Option D, vitamin B2. Right answer here is option C, vitamin K. As you know, vitamin K is known as the clotting vitamin. It is responsible for clotting. Thromboplastin converts prothrombin in the plasma to thrombin. Vitamin K is required for formation of thromboplastin. So this is the relation of vitamin K with the blood clotting. Next question. The umbilical cord contains which of the following? 2 arteries and 2 veins, 1 artery and 2 vein, 2 arteries and 1 vein, 1 artery and 1 vein. The right answer is 2 arteries and 1 vein. So here see the diagram. The umbilical cord contains 2 arteries and 1 vein. Memory tip is UC, that is umbilical cord, P1A2. Vein is 1, artery is 2. See the diagram here. Vein is 1, that is blue color, artery is 2. So UC V1A2. Next question. A nurse plans to receive a nurse's gestation newborn with UPCAR core 1 and 4. In planning admission for this infant, nurse's highest priority is option A, set up IV line with 5% dextrose in water. Set the radiant warmer, control temperature at 37 degrees Celsius. Option C, to connect the resuscitation bag to the oxygen outlet. Option D, turn on the apnea and cardiorespiratory monitors. Here, the right answer is connect the resuscitation bag to the oxygen outlet. This is also coming under the priorities and ABC protocol. Here you can see the resuscitation bag and the oxygen is having the highest priority, so we have to go for that answer. Next question. The process by which muscular fibers of the cervix are pulled upwards and merged with the fibers of the lower uterine segment is known as option A, formation of the retraction ring. Option B, sign of placental separation. Option C, effacement. Option D, receptive relaxation. The right answer here is option C, effacement. Effacement is the process in which cervix thins and softens in preparation for childbirth. Fibers of cervix are pulled upwards and merged with the fibers of lower uterine segment. You can see the effacement here. Here it is closed and this is getting thin and dilated. So this is effacement stage. Effacement stage of labor. Next question. Which is the mode of inheritance of cystic fibrosis? Option A, autosomal recessive. Option B, non-Mendelian. Option C, autosomal dominant. Option D, X-linked disease. So the right answer here is option A, autosomal recessive. Cystic fibrosis is an autosomal recessive genetic disorder. Autosomal dominant traits pass from one parent to their child, but autosomal recessive pass from both parents to their child. You can see the diagram here. In genetics, it will be discussed more details. This topic is winding up now. Thank you all for watching this video and please subscribe and share this video for more videos coming in the series. Thank you so much.